friend from California would like to jump in here.
I was recently at a meeting with a number of doctors in my district at one of my local hospitals, and this one doctor said, look, Congressman, I want to tell you about something that just happened. This fellow happens to be a plastic surgeon. They had sent somebody over for him to sew up this fellow's head. He had fallen down, split his head open, gone to an urgent care facility, and there they looked at him. They had him have either a CAT scan or MRI. I'm not quite sure which. And I said, well, what was the problem with that? He said there was no medical indication of that. He said what should have happened is, and worried about a subdural hematoma, I believe, he said what should have happened is that you tell the patient, the chances are maybe 1 in 1,000 you might have that. Here's the situation. If over the next 6 hours these sorts of things are evidence, then you come back, and at that point in time we do it. He said they took it. Of course, it showed nothing positive whatsoever before they came to him. Then he sewed the person up. He said that expense to the system is one of those kinds of things that he said was exactly the defensive medicine that he, the doctor, said we ought to stop. He gets nothing out of that. That's paid into the system. I don't know if it's $900 or something like that for one of these. But he said, I would have been doing my job as a doctor to sit down with the patient and tell him the chances are about 1 in 1,000 perhaps that this might be the case. But here's what you can do to make sure that the indications are such that we would have to do it. That's just simple, common sense medicine and a relationship between the doctor and patient, which is interfered with now because of the specter of the possibility of a lawsuit. It is that kind of real stuff, real occasions, that adds tremendously to the cost of medicine. Now, there's no medical malpractice lawsuit. There probably is never going to be one filed in that case. So some people say, well, the costs that you're talking about in terms of defensive medicine are not that large. Yes, they are if you talk with the doctors who actually do this.